Health authorities in the US say the drug use crisis is getting worse. Mental health issues caused by pandemic lockdowns have led to an increase in prescription drug overdoses. The opioid crisis was declared a public health emergency in 2017, but despite this increased awareness and federal funding, more Americans are losing their lives. Motheo Khoaripe reports.
In the 12 months to April of this year, more than 100,000 people died of a drug overdose in the US. It's a sign that America's opioid crisis is out of control.
Since we've been keeping track of these deaths, going back to the 60s, we've never seen anything like this.
The death toll calculated during the height of the coronavirus pandemic is the highest on record and is an increase of almost 29% on the previous year. Studies have shown that lockdowns and quarantines exacerbated mental health issues for many, and clinicians say that's likely a contributing factor in the increase in overdoses. According to officials, the painkiller fentanyl, a drug 50 times as powerful as heroin, is one of the main culprits. Fentanyl has been a crisis in itself since 2013, and its toll on American lives and economy has been mounting. According to the healthcare industry research provider Premier, $35 billion was spent last year on hospitalizations and other healthcare costs for patients suffering opioid overdoses. Drug-related crime is also on the rise, costing nearly $15 billion in losses and legal costs in 2020. The overall economic loss is much higher, $92 billion, due to premature death, opioid-related incarceration, or inability to work due to health issues. President Joe Biden has called these new figures a tragic milestone and epidemic of loss. His landmark American Rescue Plan, which was passed to combat the economic effects of COVID, has pumped millions of dollars into expanding access to mental health care. But while fentanyl is still available both over and under the counter and on the streets, it's bound to keep destroying and taking lives. Motheo Khoaripe, TRT World.
For more on this, Robert Cantor, who is an international recovery advocate, joins us now from New York. Thank you for being with us today. Robert, Biden said that through the American Rescue Plan, we've delivered nearly $4 billion to strengthen and expand services for substance use disorder and mental health. How much out of these $4 billion, though, will be actually spent on fighting opioid abuse and overdose?
First of all, thank you. It's an honor and privilege to be here. And this is a public health emergency. Those were very, very grim numbers, and those numbers are actually underreported. It's really, really difficult to say. That money takes time from Congress to be authorized to trickle down for the strategy that just came out by the government for recovery, for harm reduction, for support, for evidence-based treatment. It's happening, but it's happening slowly. The problem we have, and again, thank you for having me, is that unfortunately the planets have aligned between the pandemic and between fentanyl, which I just cannot stress enough how potent and how brutal it is. It really just has exacerbated an already public health emergency, and it's really gotten out of control. We're hoping that as media coverage is increased, we're hoping as these dollars are given to all of these research and harm reduction and evidence-based treatment, that these numbers will go down, and obviously when the pandemic quiets down, that they will. But as we speak right now, those are record numbers. They're very grim, and a lot of people are dying.
Right, and just a question on data collection, and then we'll get back to that. There seems to be a problem when it comes to data collection, which is paramount when fighting addictions. Different jurisdictions in the US have different ways of documenting overdoses. I mean, what should states do to get standardized but also up-to-date data?
Well, the data comes from, the statistics come from systems that the government uses that are not completely accurate, because the information is coming from death certificate. And sometimes you have what's called death pending investigation, where they're not all reported. And that's why I said to you, the numbers are actually higher. They're doing a good job on the statistics. This is really about funding and treatment. The statistics are important. It points out the severity of the situation. and the epidemic, but it's really about getting that money to treatment. I think I talked about this last time when I was here about the Purdue Pharma bankruptcy settlement and the importance of getting money now rather than letting get into the judicial system and getting that for treatment. This is not about punishing the problem away. This is not about incarceration. This is about treatment. When you have treatment, you have recovery, demand goes down, and there's less need, and there's less on the streets, and then hence there are less overdoses.
Right, and one last question. You just touched on this, and COVID and lockdown in particular had a dramatic impact on drug overdoses and mental health issues as a whole. What can be done to prevent another wave of overdoses should another lockdown be implemented in the US, in Europe this winter?
Well, for example, I'll give you an example. We have telehealth that we didn't have right now. So when you have that interruption of treatment and you combine it with issues of grief and issues of loss and just this disruption of in our society, people get sicker. People get sicker, and I think a lot of lessons have been learned on how to adjust the treatment environment and how to adjust the recovery environment so that more people have access to it.